It's now my pleasure to introduce Tyler Lane, who's a Senior Research Fellow working on the Hazelwood Health Study, and he'll update you with the latest findings of our adult survey.
Thanks very much, Michael. So the updates I'm going to provide today are from a follow-up that we conducted with the original cohort. So from the 4,000 people who were originally surveyed in 2016 and 2017, we followed up with 612 in 2022. So about 8 or 9 years after the mine fire itself. And there are two real focuses here. The first was long-term respiratory health. Whether the smoke exposure from the mine fire had long-term effects, and also whether the emerging COVID-19 pandemic may have exacerbated effects or the smoke from the fire made people more vulnerable to COVID. We also wanted to look at any protective effects of things like diet. So the survey addressed these three broad topics, and I'll speak to each one of those today. The first question we wanted to address was the long-term risk of respiratory symptoms as it relates to smoke exposure. So this is divided into the initial survey. So what differences did we see at 2016, 2017, so 2 to 3 years after the fire in respiratory symptom prevalence? And then at the 2022 survey, whether there were changes from that initial difference. And what we found at the initial survey was that chronic cough, current wheeze, and chest tightness were all higher in prevalence among those with smoke exposure. But when we look at the follow-up survey, we see something pretty interesting, and that's chronic cough. Prevalence has worsened as a result, or sorry, not as a result. We can't say that for certain, but in association with smoke exposure. So that means there was a higher prevalence of chronic cough 2 to 3 years after the mine fire in association with smoke exposure, and that got even worse 8 to 9 years later. And we also see some evidence, it wasn't quite as certain, so we can't say it with as much strength, but some evidence that current wheeze also worsened as a result of smoke exposure. So this is a bit concerning because chronic cough is quite a serious health condition. It's associated with deterioration in physical, social, and psychological health. So it's something that we probably want to keep an eye on. The next question in this study that we wanted to address was whether having a history of COVID-19 after smoke exposure increased the prevalence of, worsened the effect of smoke exposure. So when we look at people with no history of COVID-19, we see that chronic cough, higher prevalence in association with smoke exposure, same with current wheeze. But when we look at people who reported a history of COVID-19, so this isn't having COVID at the time of survey, but at any point from the start of the pandemic, there was evidence that chronic cough and current wheeze was associated with smoke exposure. So smoke exposure was still increasing the prevalence of those, but some other symptoms were emerging, most notably nocturnal shortness of breath, chronic phlegm, and possibly chest tightness. So this is telling us that after smoke exposure, developing or contracting COVID may make it more likely that smoke causes some of these respiratory symptoms. So we're seeing a convergence of two public health threats. First, smoke exposure from landscape fires, coal mine fires, and respiratory and viral pandemics. So again, another emerging concern that the two are making each other worse. The next question was whether smoke exposure makes it more likely that you can contract COVID. We've done a review leading into this to see that there is actual considerable evidence linking air pollution to COVID-19. Specifically, the particulate matter air pollution seems to make people more vulnerable. But that's all looking at background air pollution where you have chronic long-term exposures. Question for us was, if you have an extreme but medium duration exposure many years in the past, did that make you more vulnerable to contracting COVID and having severe disease when the pandemic emerged? And what we found was that smoke exposure was associated with COVID-19, but we can't say with certainty that the association existed. So what I'm saying is, there's a positive association, but not strong enough to say certainly, yes, there was an association, definitely. Uh, and when it comes to severity, because there is evidence linking air pollution to severe COVID disease, only 1% of our sample reported any sort of hospitalization, which was our marker for severity. So we couldn't do any reasonable analysis there to determine whether smoke exposure increased the likelihood of severe COVID-19. Uh, in conclusion, we can't really say much with great certainty about these results, other than there's still enough evidence to treat the association as real because the consequences would be so dire. No one wants to contract COVID or have a severe infection, and there are many reasons to avoid smoke exposure as it is. Finally, the third question is still underway in analysis. The paper is almost complete. This is looking again at whether diet offers any protection against the effects of smoke exposure. So the results are still emerging and preliminary. We're not seeing a terrible amount there, but though there might be some protective effect of fruit consumption. And what I mean by that is if you've had smoke exposure but also have higher fruit consumption, it seems that there's a lower prevalence of chronic cough.